Next presenter is Mladen Poluta from South Africa. Mladen, the floor is yours.
Thank you, Kaliroy. Good morning, good afternoon, good evening, colleagues, wherever you may be. I feel privileged to be part of this webinar, and my presentation will complement the perspectives offered by my colleagues. And as Yadin indicated, I will take a systems look and look at stakeholders essentially outside of the narrow clinical engineering family. Next slide. So we're all familiar with this. This is taken from one of the excellent publications coming out of WHO under the leadership of Adriana Velasquez Berumen, which shows the interfaces that we're all familiar with between clinical engineering practitioners and other role players in the healthcare space. So as can be appreciated even in this rather simple diagram, there are many interfaces that need to be functional if the proverbial center is to hold. And this is what happens in many cases on a daily basis. Next slide. So what is the bigger picture? This is taken from the excellent publication by Nascimento, Khalil, and my fellow presenters, Tom and Yadin, of the CED survey that was done in 2017. And one can see on the right that in the space of some 20-25 years, how clinical engineering has advanced as a profession to include areas that are enormous in themselves. For example, technology assessment, project management, quality management, and of course now the ubiquitous information technology, which is enveloping all of us with some intended consequences and some unintended consequences. But this is the progression of clinical engineering in terms of the bodies of knowledge and the bodies of practice. Next slide. Again, taken from the same publication, you'll see on the left the activities that were fairly typical in the survey that was conducted. And you'll see now there are areas around education, the areas around facilities management, which until fairly recently was not considered to be part of facilities management, of clinical engineering. You'll see very important risk management and safety, and even product development, which during the last year with the COVID pandemic response was a significant activity for many clinical engineering practitioners around the world. And on the right, you will see the types of employers that typically clinical engineers find as employees. And you will notice that in this example here, the majority are, as we would expect, in the healthcare environment, in the healthcare space, doing, as it were, the service coalface, as I said, as was experienced by many clinical engineering practitioners during the last year as part of the COVID pandemic response. But then you'll see that there are also many varied, for example, standards development organizations, consulting, international aid organizations, medical equipment vendors. And so here's the challenge to clinical engineering. Can you put all of these different role players, if you like, with different job descriptions, different perspectives into one family? And of course, the answer from the GCEA side is, of course, and yes, in fact, it becomes an imperative, we must. There must be a unifying vision and united mission that pulls all these different perspectives and capabilities into a broader vision and mission. Next slide. So in the middle of this graphic, you will see the, probably to you, familiar extract from, again, one of the excellent WHO medical device technical series publications, which shows the normal phased steps of health technology life cycle, from regulation to assessment to management. And what was particularly relevant to the last year or so has been the important role of early stage health technology assessment in informing COVID-related innovation. But at the same time, we need to look at context. So that's where hospital-based health technology assessment came in. And of course, we need to, particularly with the concerns now around global warming and carbon footprint, we need to consider safe disposal of these devices. So what this slide is suggesting that health technology assessment as a broad toolkit plays a very important role in the governance of the life cycle management of technologies. And all of this has got one primary objective, and that is to increase and optimize access to health technologies by the whole host of patients at all levels of healthcare. And so clinical engineering practitioners become custodians of the health technology life cycle. Next slide. This is a similar representation, but it indicates the important questions that are asked as part of the health technology assessment methodology. Can the technology work? Can the technology work in this setting? Should the technology be implemented in this setting? And how should the technology be implemented in this setting? So those are, if you like, fairly conventional questions that are asked of health technologies generically. But of course, these all became very relevant, very important, and on occasion very difficult to address during the COVID pandemic. So it has heightened our awareness as to the importance of being able to face these questions head on and honestly and professionally provide the answers and look at issues like technical performance, efficacy, effectiveness, appropriateness, and ultimate implementation. And as the previous slide suggested, yes, regulation has got its place and formal health technology assessment has got its place, but clinical engineering and health technology managers have got the responsibility for ensuring the full life cycle optimization. Next slide. So these are what are called the health technology assessment evaluation domains. I'm not going to go through them individually, but you'll get a sense of, again, important questions that are asked in addressing each of these. And not all of these are relevant for every single technology. It could be just a small subset. But again, important questions with numerous linkages to clinical engineering, mental health technology management. And so again, it falls on clinical engineering and health technology management practitioners to address these, face these head on, provide the evidence in support of decision making. Next slide. These are some of the decisions that are taken. If you look at the right column in the slide, so important decisions. And the challenge, of course, for all of us in the healthcare space, and particularly at times of a pandemic, is to be able to find sufficient evidence in order to make the good decisions at the time that they need to be made. And on the left, you'll see the different organizations, individuals that are involved, that are stakeholders in this health technology assessment and life cycle management optimization process. And you'll see it includes government agencies, other healthcare professionals, hospitals and healthcare administrators, private sector insurance, patients, most importantly, and caregivers, and last but not least, academia. Next slide. So it really does take a village. And this is just a look at processes and structures that could be considered to be related to health technology and health technology management. So center, you'll see healthcare engineering, which itself can be broken down into clinical engineering, biomedical engineering, medical device engineering, innovation, and hospital engineering. But also there are complementary professions, health professions, of course, physicians, nurses, and non-medical professions. So these are medical physicists, clinical technologists and technicians, radiographers, etc. And not to forget the hospital managers and the administrators. So these are all members of the orchestra, and they need to be aligned, they need to be in tune. And so again, there's tremendous opportunity here in terms of exploring mutual recognition and collaboration with bodies that represent these professions. Next slide. So now we go back to engineering basics. So in fact, there is a World Federation of Engineering Organizations. It was founded in 1968 under the auspices of UNESCO. It represents more than 30 million engineers globally. There's also an International Engineering Alliance, and it notably has provided a benchmark framework for graduate attributes and professional competencies. And you will see the accords, the 3 accords that cement essentially the attributes and professional competencies for professional engineers, engineering technologists, and engineering technicians. And then also it lays down profiles for graduates in those categories of engineering practitioner. Next slide. So what the International Engineering Alliance has done, it has revised, in fact, these attribute sets and professional competency guidelines, and that was done recently. It has also provided new pedagogies and values that include issues such as sustainable development, diversity and inclusion, and ethics, factors which we can no longer ignore, especially in this day and age. And so again, there's an opportunity together with partners such as IEA to advance clinical engineering, because these issues are important to us generically as engineers, but they're particularly important in the healthcare space. And so coming to the graduate attributes and professional competency sets, again, the IEA has provided these, and these are available as templates for CE-related capacity building. So that'll help to standardize capacity building and professional development programs in the clinical engineering space. Next slide. And this goes back to what happened in South Africa, if I can put it into local context. In 2002, shortly after our Ministry of Health published its framework for health technology policies. Now that called for a national health technology management system where clinical engineering and health technology managers would be at its core. So at the time, clinical engineering practitioners were not registered with any professional organization, and the Ministry of Health, National Department of Health, approached the Engineering Council of South Africa with a request that the Engineering Council implement a scheme for professional registration of clinical engineering practitioners. This would also have the added benefit, particularly in this day and age of mobility, international mobility, that those professionals would then go onto a recognized international register. Sad to relate that the Engineering Council, after an engagement that lasted for 2 to 3 years, came back and said to us that they were unable to recognize clinical engineering specifically for the reason that the International Engineering Association did not. So 20 years on, there's a great opportunity to gather our resources, to align amongst ourselves, and once again to approach the IEA with a much stronger case now, I believe, aligned with our hospital engineering and biomedical engineering colleagues to make a strong case for healthcare engineering as, if you like, as a grouping of disciplines to be recognized formally by the International Engineering Alliance. Next slide. So I'm coming to my conclusion. So this is taken from a publication by a colleague and friend, Stephen Grimes, essentially saying what we now know, that the change is a given, but it comes with challenges. And so particularly after this last year, we know that those challenges can be fairly significant, and they can be significant at different levels in one country and across countries and internationally. So there's a new normal, and we still don't know what the new normal post-COVID is going to look like. But one of the silver linings from the COVID-19 cloud is the many new linkages and collaborations that have been established. So in a sense, we are at the crossroads. We face an uncertain future, but we have created alliances facing a common enemy. And I think more important than ever, it's important that we as clinical engineering and health technology management practitioners have got an organization that speaks with one voice for us all. Thank you. Next slide.
Thank you, Mladen. Thank you for your very informative presentation.